Good afternoon. This is the Thurston County Board of Health for February 13th, 2018. I'm Commissioner Bud Blake, the chair of the Board of Health this year. I'd like to start off by doing some introductions. To my left is Commissioner Gary Edwards. To my right is Commissioner John Hutchings. To his right is Lydia Hodgkinson, the clerk of the board. To her right is Art Starry, the assistant director to the Public Health and Social Services. And to his right is Dr. Wood, the health officer for Thurston and Lewis County. And to her right is Ramiro Chavez, the county manager. With that in mind, I'll call the meeting to order and ask the board if there's an approval or motion to approve the agenda for today.
I move to approve the agenda for February 13, 2018.
Second.
It's been moved and second to approve the agenda for February 13, 2018. All those in favor say aye.
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 Aye, and that motion carries. Is there a motion for meeting minutes for January 9th and the work session summary for January 9th, 2018?
I move to approve the meeting minutes from January 9, 2018 and acceptance of the work session summary from January 9, 2018.
Second.
It's been moved and second as stated. All those in favor say aye.
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 Aye, and that motion carries as well. So one of the things we like to do is a proclamation, and this month we are celebrating or going to give a proclamation of American Heart Health Month. And I'll ask Mr. Mark Moffitt to come to the podium to speak on behalf of the Public Health and Social Services, and then we have a proclamation to read.
Good afternoon, Commissioners. I'm Mark Moffitt with the Public Health Department. It's an honor for me to present this proclamation to you today, especially in light of what's happened in my family over the last couple of days. But first I must say, every time I step to this podium, I'm always expecting to receive an award, but it hasn't happened just yet. Today, I plan on changing that just a little bit. By silently accepting this proclamation on behalf of my mother, 3 days ago, I had the honor of standing by my mother as she passed away, due in part to cardiovascular disease. It's a disease that took hold of her many years ago and deteriorated her health slowly and succinctly. This proclamation today should raise awareness to this disease not only within our county, but in our individual families. I appreciate your time today in proclaiming February as American Heart Health Month.
I'm sorry to hear that.
Yeah.
Thanks, sir.
Okay, do you have a proclamation?
I do. You ready? Whereas cardiovascular diseases are the nation's leading cause of death and costliest disease, and indirect costs in the United States estimated to be $316.6 billion. And whereas, while progress has been significant in reducing deaths from heart disease, it is still the #1 killer of both women and men. And whereas about 801,000 people in the United States die each year from heart disease, stroke, and other cardiovascular diseases, equivalent to approximately 1 of every 3 deaths in America. And whereas 2,200 people in the United States die from cardiovascular disease each day, and about 92.1 million American adults are living with some form of cardiovascular disease or the after effects of stroke. And whereas an average of 585 people die from cardiovascular diseases in Thurston County each year. And whereas the American Heart Association's 2020 Impact Goal seeks to improve the cardiovascular health of all Americans by 20% while reducing deaths from cardiovascular disease and stroke by 20% through research, population and community level interventions, public health and policy measures. And whereas about 80% of cardiovascular disease may be prevented through everyday healthy living steps, including physical activity, good nutrition, not smoking, maintaining healthy weight, and controlling blood pressure, cholesterol, and blood glucose levels. And whereas the American Heart Association encourages citizens to help save lives by calling 911 if symptoms occur, getting trained in CPR, and promoting comprehensive automated external defibrillator programs in their communities. And whereas the American Heart Association is celebrating February 2018 as American Heart Month and promoting education and awareness by encouraging citizens to learn the warning signs of heart attack and stroke. Now, therefore, be it resolved, the Board of Health hereby proclaims February as American Health Month in Thurston County in recognition of the importance of the ongoing fight against heart disease, and urges all citizens to recognize the critical importance of identifying symptoms, taking preventative measures to live healthy, and incorporating tools and skills that will increase survival rates and save thousands of lives each year. Adopted this 13th day of February 2018, signed by your Board of Health.
Yeah. Stay right there. We have a question for you. You have any comments or questions for Mark?
Just my condolences in your situation, sir.
Okay.
Sure. Any comments for Mark?
Well, yeah, and I have 3 older brothers, and my oldest brother died of a heart attack, a massive heart attack, back in the mid-90s, and they brought him back to life. He died again on the table, and again they brought him back to life. And then months later, he had a 3rd one, brought him back again, and now he lives with that issue. He's living in Tri-Cities, and he seems to be doing fine. But it's always one of those things, you know, he's not a cat. But you always worry for that shoe to drop, you know. So that's the only heart issue that's really touched my family, but it was very powerful at the time. So I can't even imagine your loss, which you're profoundly going through at this time.
Yeah, likewise, condolences, and I know it's hard to get up here after 2 or 3 days, but it just speaks volumes to your commitment and leadership, not only for your mom and your family, what have you, but what public health means to you and represents for the county. You're wearing a red shirt, as many people are wearing red today, and we have the red corsage on, and we might just read a proclamation, but it's awareness, it's education, and it's a lot of other things that we can do to keep people healthy, and that's what it's really all about in terms of a public health forum and so forth. But and if you didn't know it, Thurston County is one of the highest ranking locations. If you have a cardiac arrest of some sort, we have the best medic ones in the world. They respond not only the quickest, but the best on the scene. I think we rank like number 3 or number 4 in the nation as a whole, even though we're a little tiny county against some of the larger cities and their advanced systems. There's just another item that speaks volume to the care that we give in terms of cardiac and heart healthiness in terms of what we're doing here for Healthy Heart Month. So thank you so much, Mark. And you come up here and receive this for us and then take it back and post it to Public Health. So you bet, sir. You bet.
Thank you. Thank you, sir.
Thank you, Mark. God bless you.
Okay, so the next item we have after the proclamation is the opportunity for the public to address the board. And today we have, so let me tell you, it's a first come, first serve sign in. And so if you haven't already signed in, that's okay. I'll bring you to the podium in just a second. I have Mr. Dennis Neal, who's going to come to the podium and talk about Northwest Resources and Behavioral Health.
Yeah, we have one.
And we're going to do 3 minutes.
Good afternoon, Commissioners. Thank you for the opportunity to come back and speak again about advances that Northwest Resources, working with Thurston Mason BHO, treatment sales tax dollars, county and other funds, some of the advances and things that we've been able to do. And in the last year, we've been able to become a fully integrated substance abuse mental health facility that offers, we have available now substance abuse, intensive outpatient treatment services, outpatient mental health services, psych med services, housing services, intensive case management services. We have case management for pre-release and post-release in Nisqually Jail, and we have and in Thurston County Jail. That's not Northwest Resources, but it's due to the treatment sales tax dollars, and also housing support case management in Thurston County Jail for inmates who are being released into the community. And for a long, long time, you know, we struggled with having, you would have substance abuse services here, you would have some mental health services over there. There was no such thing as intensive case management services out in the streets, that type of thing. And we had funds, Medicaid funds, available to us to put people into inpatient treatment, but they would be homeless or living in a domestic violence situation. And so they would go to treatment and they would come back and they would still have all of those issues to deal with. And scattered out. And today we can say here in Thurston County we have all of those issues in one house where we can address the individual's needs. You know, that we can meet them in the jail, and so that they have an appointment when they get out, or they can get a treatment bed date and we can have a case manager pick them up and get them to the bus and get them there. To treatment, or when they're coming out, get them into a safe, sober, clean environment that just really increases the recovery rates tremendously. And then I wanted to tell a little bit. Oh, sorry.
It's all right.
One story of one individual who my staff said, you know, I was like, which story? And they're like, well, you should, because there's many. This is just one of many of these stories. But we had a lady who came into Northwest Resources. She was with CPS, Child Protective Service. She was on Department of Corrections, and she was in Olympia City Community Court. Had all of those issues going on. And had been treatment in the past. However, this time she came in, she had lost 3 of her youngest children through custody, through Child Protective Services, prior to coming to treatment. But when she came into treatment, she engaged in mental health services, psych med services, and SUD services, all in the same place. So the psych med person can be talking to the mental health person, who can be talking to the substance abuse person, and also connected with the housing people who got her into clean and sober housing. And today, she's off DOC, completed community Olympia Therapeutic Court and down in Olympia. And she still helps and volunteers at the community court down in Olympia. She engages in 12-step meetings in the community and chairs meetings and does that. And she's also active in the Oxford housing community too, clean and sober housing, and has gotten half-time custody back of her oldest child. You know, just a real success story, you know. And the important thing here is that she's continuing in the services, even though she's no longer on DOC, she's no longer with the community court, Department of Corrections. Yeah, thank you, yes. Mm-hmm. So she's completely off of what they would call paper, and she continues to thrive within the community. And we really feel that it's due to being able to have all those services located in one place, which is really due to Thurston Mason BHO treatment sales tax dollars and a whole lot of people working together to make that happen. So we just wanted to say thank you to the work that you guys do to help those funds come about. And thanks.
You bet, absolutely. Stay right there for a second. Do you have any comments or questions?
No, you help a lot of folks. Thank you.
No, and that's just one of numerous success stories. And I love the treatment sales tax and what they're doing, what we're able to do with that.
Yeah, we find the Thurston Mason BHO and the treatment sales tax a critical asset to not only what you do, but many others out there. And despite any of the criticisms and naysayers out there, when the system works and we hear stories like this, it's a remarkable turnaround. It just makes us very proud and what everybody's doing to take care of another human being and keep them on, say, off of the substance and mental health piece there is a wonderful, joyful experience, isn't it?
It's the old starfish parable, you know. I'm not going to go through that, but some of the naysayers, well, you can't help everybody. You're not going to save everybody.
Right.
No, but it meant something to this one.
Help this one, yes.
Yeah, it meant something to this one. Save this life.
All right.
Yeah.
If I can,
You can. Go ahead.
years ago when we didn't have the housing, that the treatment sales tax is instrumental. We wouldn't have the housing if it wasn't for the treatment sales tax. And prior to the treatment sales tax, when we would take these people who were homeless, send them to treatment, they would come out of treatment and wouldn't engage in outpatient services. They were homeless again, or they were moving into these domestic violence situations, or into the crack house that they were living in before going to treatment. And 30 days later, we're sending them back to detox and back into treatment. And we had a small rate, but just housing people for 3 months, maximum 3 months, and they have case managers who help them get a job or help them figure out their Social Security disability or whatever's going on like that. We've increased those odds. We went from a 20% success rate to an 80% success rate. It is tremendous what the housing and treatment sales tax dollars is doing just in that area alone. And I've been doing this 31 years. It's the most amazing thing that I've seen.
Yeah, housing rocks, doesn't it?
Yes. So thank you.
Okay. Thank you so much, Dennis, for your words there. So I'm going to move on in the program, and we're going to go to department items. And we have with us today a Thurston Thrives update, and it's going to be about the Community Design and Healthiest Cities and Counties Challenge. And I have Mr. Chris Hawkins, who is a program manager for that. He's going to introduce the program manager or the regional vice president for public labor sector for Aetna, and I think it's Mr. Matthew Sherrill. There you go. So, and Chris is setting up his presentation. It'll take just a second there, and we are doing really great here as far as Thurston County, and Chris is going to tell us about the, I'll say reward or award that we are going to receive. No, that was not it. There we go. That's more like it.
It's in the PDF form. It's not in PowerPoint.
Okay.
Got a glitch once in a while.
Gonna have to wing it.
So give an overview, introduce the people that you brought with this, and tell us about the award.
Absolutely. So Chris Hawkins, I'm Community Engagement, Evidence, and Partnerships Manager with the Public Health and Social Services Department. Good afternoon, Commissioners. I'm here to give an update on the Community Design Action Team of Thurston Thrives and our efforts in the past couple of years, and an exciting announcement for today's agenda. So the Community Design Team started out with a team composed of a multi-sector membership, as with other Thurston Thrives action teams. That includes the cities here locally, as well as a number of nonprofit partners and Thurston Regional Planning Council. That group met from the start of Thurston Thrives and developed its shared strategy. And that shared strategy consists of looking at how we can reshape the community design of Thurston County to make it more supportive of people getting daily physical activity. One of these preventive, healthy living behaviors that we want people to engage in. And that includes things like going for a walk in your neighborhood, using a bike or transit for your transportation on a daily basis. So that active transportation component is a part of this as well. And as you might imagine, that depends to some extent on how our communities are laid out, how our built environment is designed and developed. That includes not only land use, but also how connected our streets are, whether there are destinations within easy reach of where people live, So a mix of uses near where people live or work makes a difference for this, as well as having those safe and comfortable environments for being active, whether that's a trail or a park or other features of the built environment in our communities that make it easier to be active. Looks like we might have our slideshow after all. Thank you, Ramiro. So this is catching up with me now. The goal of the team is that people are physically active in their daily lives. And that we put together a strategy map. Some of the elements of the strategy in terms of how we're taking action include safe routes to school projects, and that main image on that slide of a well-designed environment, helping people get around easily by walking or being otherwise active. So there's the strategy map that we put together several years ago, and on the left-hand column of that are the activities that I was just mentioning, whether that's looking at good mix of uses and design, or having good safe routes to school supports for kids and families, and complete streets in our community, as well as promoting those physical activities. And then a final part of that is making sure our codes and standards in development really align with that vision of a more active community for the future. We're going to add in this coming year some new supports, but in the last couple of years we've been supported by the Healthiest Cities and Counties Challenge, which has brought some resources from the Aetna Foundation, American Public Health Association, and National Association of Counties to our project and to Thurston Thrives. And that's allowed us to take it up a notch in some of our efforts. In this next year, we're going to be engaging more with the Park Foundation as a member of the action team, as well as Safe Kids Thurston County as we roll out some new Safe Routes to School projects. So that good built environment, I just want to quickly go over some of the evidence for that that's out there, which is that you want good compactness of development, more people living within close proximity to destinations or to things that they can do together means that people will be more active. So density. But also diversity, that mix of uses, which puts the destinations that people want close to where they live or work. That makes a difference. So this schematic shows different kinds of land uses, red being residential, that being housing, but also a mix of commercial and other destinations. Parkland makes a difference in terms of how active people will be. And then finally, that good urban design that invites people to go out and be active. Safe street crossings, frequent, well-marked places for people to go, and pathways for them to get there. All that is rolled up in this strategy. We have an action plan that underlies the strategy, which includes the work that we're doing in the Healthiest Cities and Counties Challenge. That's a project to look at how trails are connecting to nearby neighborhoods. We see that as a big opportunity. There are frequently places along the trail where you have a lot of people living, but they don't necessarily have easy access to the trail in walking distance. So we're trying to identify some of those opportunities for new pathways, but also other improvements along the trail. And we've posted the results of that walkshed analysis to the County Health Department website. Just some other images of things that we're aiming for with this are those improved connector pathways, better wayfinding signage for people out using the trail system, as well as markers for mileage, and benches, which you'll hear more about in a moment. Another part of the evidence base for this work that we do in community design is a real focus on safe routes to school. That is a well-known strategy and one that's been highly successful around the United States, and we continue to do that here in Thurston County, and we're trying to expand those efforts in collaboration with a number of partners, including Thurston County Public Works. Some images from recent projects that we're involved with. There is a project being built right now out at Lydia Hawk Elementary School, which is adding some new sidewalk in close proximity to the entrance of that school. as well as some other street features that will make it safer for kids and families. And then in the next year, we anticipate starting a new project around Olympic View Elementary School, so out in that, again, eastern part of Lacey, actually in the county, and trying to make improvements that, again, will make it easier for kids to walk and bike to school with their families. And we've been collaborating on those two particular projects with Thurston County Public Works. So we've made a lot of progress in the last couple of years. We've been involved with this challenge. We've been doing the Safe Routes to School projects, and we anticipate doing more with some new schools. We did start with Rainier and Tenino and some other southern Thurston County schools in 2017, so we'll build on that. And we'll also be helping to advise some other jurisdictions' efforts. City of Lacey is working on a bicycle and pedestrian plan right now that's informed by our trail walkshed project. And we've been working with City of Tumwater. They've been establishing some new trails. That's one of our key measures, is how much actual trail is available to people in Thurston County, so that we're adding to that inventory of active spaces. And I should mention, too, that TRPC, Thurston Regional Planning Council, will be updating the regional trails plan, so that's another avenue for providing some good information and advice from our Healthiest Cities and Counties Challenge project. And this is just an image of what we've done with that Healthiest Cities and Counties Challenge project. People can find more of this information on the county's website. But we've identified places where there would be a high benefit from new access to the trail system, that being those orange dots there. And the size of those dots corresponds to the number of people living nearby or working nearby. This happens to be our neighborhood out at Lily Road, where the health department is located. There's quite a bit of employment there, and a lot of people living there as well, some high-density housing. So a real opportunity to create some new access for people to get out and use that trail and be active, whether it's going for a walk with friends or getting to and from their job. We'll also be sharing some of the results of that walkshed analysis with lots of other jurisdictions at an upcoming forum in March. And we'll be, in this next year, also setting our sights on expanding those Safe Routes to School efforts. So we're looking forward to coming back to you and sharing still more progress on this. In the end of 2017, we learned some really great news that I'm going to invite Matt Sherrill up here from Aetna to speak to us about. We're excited to hear about an announcement they have to make. It's going to help us expand on these efforts. We've established some new benches with our trail walkshed project. And Matt, would you like to come up and share some news with folks?
Sure. Hello, sir.
Hi there. My name is Matt Sherrill, and I'm with Aetna's Public Sector and Union Benefits team here in Washington. And our company motto is, "You don't join us, we join you." So it's great that I'm excited we're joining you today to support such a worthwhile cause. As an almost native Washingtonian, I moved here when I was 10, I'm really happy to be supporting a cause that impacts the health of the people in our community. Aetna has served our local clients since 1958 in the Seattle office, and now we have about 250 people here in Washington living and working, and then also contributing to their communities. And these social determinants of health, these things we're trying to impact, affect our employees, our families, our neighbors, our clients. And so we want to be involved in the efforts to help improve these factors and not only contribute dollars, but also contribute time. And I look forward to talking more about that with the committee, how we can get some of those 250 people down here to working on the trails when the time comes. So on behalf of the local Aetna team and also those national partners, the American Public Health Association and also the National Association of Counties, we're really excited to give the Spotlight Award to Thurston County and invest $25,000 in the project. So you may already have heard some of this, but the Spotlight Award is part of the Healthiest Cities and Counties Challenge, and it really recognizes communities that have come up with some homegrown solutions to tackle these barriers to health in their neighborhoods and in social systems. So Spotlight Award winners are early success stories that have identified some creative partnerships and meaningful programs to address the health concerns in our neighborhoods. The Spotlight Award is a really big honor, and Thurston County was chosen because of the creative partnership with Thurston Thrives and the progress you're making towards improving the regional trails and making them more accessible to residents. I think we all hope, especially on days like today, which is one of the rare and beautiful ones in our winter, to see more people out there getting healthier, getting happier, and enjoying the outdoors. So I'm sure that a number of the 500,000 or so Washington residents that are covered by Aetna live in Thurston County, and so they'll benefit as well from the planning and generosity of this group and everything they're putting into the project. So congratulations on the award, and thank you for all the work that this entity and Thurston Thrives and the board is doing, and the partners to create a better situation with the trails and improve the health of the citizens of Thurston County. Thank you for having me here.
Sure. We have questions for you. And Chris,
yes.
Do you have a comment or question?
No, thank you very much for your operation, taking the time and treasure to help us out.
Absolutely.
Yeah.
Yes,
Proud
thank you
to
very
do it.
much. Thank you.
Either one of you, Chris, or you were able to name the other 9 places? Was there 8 or 9 places that were able
Yes,
to?
I'll
Cause, I mean, it was not like 1,000 people competing. This is a very tight race here as far as the dollars and the
Right. The Healthy Cities and Counties Challenge started off with hundreds of applicants. That got narrowed to 50 finalists that were included in the Healthiest Cities and Counties Challenge back in 2016. And in 2017 was when and the partners opened up the opportunity for this Progress Award to be announced. And there were, I don't know how many applicants there were for that, but there were only 10 awardees out of the 50 who have received the Spotlight Award. There were 5 honorable mentions. We're one of the 10 here in Thurston County, and we're the only project here in the western part of the United States. The others, in case that was your question,
Yes.
are Bridgeport, Connecticut, Camden, New Jersey, Danville, Virginia, Louisville, Kentucky, and I think Jefferson County, Kentucky was included in that, Miami, Florida, and then a list of 5 counties: Chatham County, North Carolina, Leon County, Florida, Mecklenburg County, North Carolina, Waco, McLenna, Texas, County, Texas, and Thurston County.
Yeah.
Yeah, that's wonderful.
Full West Coast.
Yeah.
All those Midwesterners and Easterners can eat our dust, huh, on this.
Beautiful.
So, sir, thank you and for your generosity also for coming here today and presenting that. It's phenomenal how the two come together as far as well, Thurston Thrive is not an organization, but the county as a whole and Thurston Thrives, social determinants. You could look at clinical all day long, but social determinants plays a huge role in community health, and with your support and your backing, it will put us a little bit further down the road as far as not only community design, but the other teams in Thurston Thrives Council will be able to do better here in the near future. So thank you for your time and your commitment to it. So, yeah, we'd like to get a photo. Yeah, let's do that.
Is there a certificate or something that gets, you can't put that up on a wall, but is there something that says we got a gold medal for this or something?
Yeah, Chris, introduce the people who are coming up.
I think we'll take the check.
Yeah.
You want to bring some of the other people from? Come on up there, Karen and yeah.
Liz.
Who else is a part of the community design? We'll put you in the middle right here. There you go. Liz, come on, Liz.
Yep.
Come on, Liz.
I am.
This is way cool. Thank you very much. I missed the meeting this morning, so I didn't know this was happening.
I'll put Liz, get
Yeah,
right here in the
great.
middle, right here. In the middle? No. No, he's tall, yeah. We'll put the tall in.
Don't beat me up, and I have everyone just scoot over to the right. A little bit more.
Is this too high, too low?
What's this mean, this way? It's like my wife. Now, what's this mean?
Is it too high, too low?
No, it's perfect.
Okay. Is it balanced?
It's totally straight. 1, 2, 3, 2, 1 more. 1, 2.
Okay, great. Yay! Thank you, sir. You bet.
Thank you very much.
And thank you, Chris, very, very much.
Good job, Chris.
Thank you, sir. All the work you do.
Chris, I suppose you rode your bike today too, right? Yeah. I asked him that on rainy days, and he's rode it that day too. So.
Okay, so another department item we have is the Veterans Program, what we have here in Thurston County, and then we have Mr. Martin Moffett from the, who's a Community Program Manager for Public Health and Social Services. He's going to give an overview of the Veterans Program here to Thurston County. Go ahead, sir.
Yes, sir. Thank you. So today I'm just going to talk to you about some of the great things that's happened over this past year and some of the changes that are going on. And then also the big thing is to introduce you to the well-anticipated Veterans Assistant Specialist, Ashley Strauss.
Hey,
Let her
good.
talk about herself.
Hello, Ashley. How you doing there?
Hi, good afternoon,
Can you do me a
Commissioners.
small favor and bring the mic down just a little bit?
There you go.
All right, go ahead. You have the floor.
Thanks for having me. So again, I'm Ashley Strauss. I'm very excited to be here. I am a Washington native, grew up in Yelm, so a huge veteran community. I started working at Madigan and McCord about 10 years ago. Married to an Army soldier.
Good, I like that.
So he is a disabled veteran, though. So that is kind of my driving passion and where I really wanted to direct my focus in my career. Working at Madigan, I enjoyed it. I loved working with the active duty, the veterans, the families, but I wanted to do more. I worked on my degree in getting a degree in human services and case management. And I was very excited to find this position and apply and taking on this position. I'm so passionate about it. Not only is my husband a disabled veteran, he's a Purple Heart recipient. I know many veterans that have come into the clinic that I've helped with different resources, and so I have a big background with that. I'm very excited to be in the community that I grew up in and now helping veterans. So far, today's my 10th day here in the position, and I've visited the jail twice now. Fortunately, I was able to visit with 3 veterans there in the jail that were incarcerated, and 2 of them we believe we can help them, and so I'm excited about that also because I feel that that program's very important. I think the Veterans Court is very important. I think that it gives these veterans the opportunity to have another chance, something that something they might not get otherwise. So I'm excited to be in this position, and I'm excited for the Veterans Fund as well in assisting these homeless veterans and veterans that need financial assistance. So thank you very much for having me.
Stay right there. Don't move.
Yeah.
You got a question or comment for Ashley?
I don't. I'm looking forward to working with you, and I can tell you're enthused to help us veterans out.
I am very.
Ashley, or Ms. Strauss, do you see the sign back in the corner over there?
I do.
That beautiful thing, Thurston County,
Yes.
Purple Heart County.
Yeah.
And thank you for serving, along with your husband, Purple Heart veteran, because I know my daughter-in-law does the same thing for her husband. Our son is a Purple Heart recipient. And you are every bit as heroic as they are.
Oh, thank you.
So thank you for that.
All right. Well, I'm very excited to start working with the program.
Yeah, sure. I'd like to add
Yes, sir.
my personal thanks and professional thanks as a veteran and a commissioner. Almost 4 years ago, I've been working for the first 2 years. These guys know to try to turn the veterans program around we have. Not that it was really wrong, but very much enhance it and build people, empower people to do what you and Mark and the others do. Absolutely grateful and wonderful to see you here. And I know we're going to do great things now for the veterans and the families of the veterans here in Thurston County. And thank you so much.
Thank you.
All right. Anything else, Mark?
Yeah, I get a few things, sir. So this program wouldn't be as robust if it wasn't for the commissioners that are sitting up before us today. You guys have done a great job advocating for veterans within the county, so I really appreciate that. And what we're doing is we're trying to make it more robust. And so we have the 4 pillars, what I see as this program. And I must say that she was in the jail as a duty during this for this. It wasn't something she did wrong. She's doing great. So the assistant fund.
It's over here. Pick your weapon there.
I was so flawless up to that point.
Now you got to use the right button.
All right. The assistance fund, that's kind of the crux of the program. And what that does is it helps with emergency financial assistance to qualified veterans. And it's limited. So it's just something to get them over that hump and get them back into the fight. And what we've done this past year is we've helped over 110 veterans in need, and it's really for the basic sustainment. So it's housing, food, and shelter. There are some other things. There's some burial that we can provide for as well, but those are pretty much the fundamentals of what we do. And then the average amount that we were able to put towards them was $585 for each veteran. So what's changed this year? The big thing is what the commissioners have supported is the MOU with Lacey. It was a $60,000 grant out of the assistance fund to help with the Lacey Veterans Hub. And what the Lacey Veterans Hub is a holistic approach to treating the veterans. So we have counselors there, we have housing, we have employment, and we also have veteran service officers that help with disability claims and ratings. So it's much better. We keep the veteran within our building instead of sending them across the county to go to another resource or up to American Lake for something, and then we lose them. So we want to make sure that we keep them and give them the resources that they need. All right. The second pillar is veterans case management. This is new to the program. Up until this point, we have been contracting it out with the Washington Department of Veterans Affairs. And what they do is what Ashley was saying earlier, they go into the jail and they look for veterans who are there for substance abuse, mental health. There's some reasoning in there. And we look to get them into the Veterans Court. This is paid through the treatment sales tax. We have the smallest contract of all the TSTs, the treatment sales tax, but we have such a large impact because when they go to the Veterans Court, it reduces the amount of time that they're incarcerated. And then we get them into treatment, and we look for federal and state dollars first before we use county funds. And what's different this year is we're taking it under our umbrella and getting rid of the contract and doing the direct service ourselves with Ashley. And the Washington Department of Veterans Affairs has been great with us, and they've provided shadowing through April for us, so we don't lose any of the resources, and Ashley is trained really well on it. Oh, and the other thing I should say is that we are going to start working with WDVA. They have offered to train Ashley and myself to be accredited with the Department of Veterans Affairs to do claims. So that will help us. One, we get to be in their system, so we can look up different ratings for soldiers, and we have better access. So they're paying for all of that training for us. Emergency shelters, our third pillar. We have two contracts in this county for veterans or for emergency shelters. The first one is with Catholic Community Services. They provide up to 4 beds a night for veterans, homeless veterans, and then also with Interfaith Works, they provide 1 bed a night, up to 1 bed a night. And you can see the stats from last year. We had 838 bed nights that veterans didn't have to sleep on the streets. And it's a very reasonable rate of $34 a night. So it's better than any hotel we're going to find out there. And then we're also partnering with those agencies, Catholic Community Services and Interfaith Works, to get them, because as you can see, we only used about half of the amount that was allocated to that program, and that was because of some inefficiencies and not getting the word out to certain veterans that could use that help, because we know there's more than 15 veterans on the streets each night. And also, a good note, of those 15 veterans, a third of them we were able to find them permanent housing. So those are ones that aren't coming back to the shelters. And the fourth pillar is the partnership, and this is really the force multiplier. Being at the hub and being able to go next door to WorkSource, who's in the building, to find somebody a job, because a lot of times they come to us looking for financial aid, but there's more problems there. There's housing issues, there's work issues, there's disability ratings that they didn't know they could even get. Maybe they need some counseling. All of that we can do at the hub, and so that really increases the ability to find the veterans the resources and to provide help for their families. And beginning this year, Ashley will be at the hub full-time, Monday through Friday, 3 or 9 when they open, 9 to 3:30. And Mondays, she'll be in the jail for about 2 to 3 hours a day. So those are the big changes and some of the great things, the great work that's been going on with the program.
Maybe.
What's
Is that
that?
your last slide?
That is. Yes, sir.
Go ahead, sir.
Do you have anything with Salvation Army for bed space?
We don't, but they came to the last Veterans Advisory Board in January and presented, and they're very interested in doing, because it's been several years since they've worked with us, but now they have some new leadership there, and she's really interested in next year's RFP.
Great. Thank you.
Any questions, comments?
Have you seen an influx in veterans applying for services in light of the VA suspending caretaker or caregiver stipends?
I haven't, sir. I've been in this role since October. I can look back at the numbers and see if from the time that started and compare those, if you'd like.
Just wondering if there's some type of a ripple effect that might have impacted veterans assistance programs at the hub.
Yeah, I can definitely look into that for you, sir.
Thank you.
Sure.
Thank you for all you do.
Yeah, it's all right. I'd like to challenge you and Ashley, and then even I see Jennifer back there, the whole team through the public health, that keep on with the keeping on as far as finding new things to do, as far as helping the veterans and their families. Don't stop, because we support veterans here from not only this board but from our families, and we want to see things done in a more modern way, the way things change socially and the way the military is changing, all those things that you talked about, where they're behind you and the rest of the team as far as that. To include things like what Chris has done, as far as a reach out to a program or a cash benefit or some other benefit. Chris has done great for his community design. It's really inspiring how the public health staff is really involved in day-to-day activities in the community. We really appreciate you, Chris, Ashley, and Jennifer as a whole. So thank you very much, sir.
Thank you, sir.
You bet. Which leads me to another great thing we're doing as far as our department item, hazardous and solid waste program review. I'm going to turn it over to Art. He's going to give us a little bit of overview, Mr. Art Starry, and then we're going to bring up Patrick Soderberg and Jennifer Johnson. So, go ahead.
Good afternoon. Again, I'm Art Starry. I'm the Environmental Health Division Director. And what we wanted to do is give you a quick opportunity to see some of the different things that are taking place within the health department that relate to dealing with solid and hazardous waste. And so probably when people think of solid waste and garbage, they think of garbage complaints and whatnot. But there's really a lot more that we do than just responding to complaints. And Patrick will give a quick overview of the different activities that we do, and I guess some of the public health rationale for them and some numbers that relate to that. And then Jennifer Johnson, who's with our KEEP program. She's here to talk about some of the education and outreach that we're doing. And it relates to trying to make sure that people have information and that others have information so they can avoid exposure to toxic materials and hazardous materials as well. So there's a lot of things that, again, we think we can do to help them. So you got the slide thing, or does Ramiro get the slide thing?
All right, Patrick, you got the floor.
Well, I'll do really quick, just a quick reminder of what we're trying to do with all this stuff. And again, it's dealing with public health, and if folks think of this stuff, it really is a core public health program. And one of the things probably many people associate is just dealing with things like rats and flies and all that. But it really is also trying to deal with making sure that we manage wastes in a way so we avoid things like that, because we're not so much worried about the rats because they have long tails and the whatnot, but because they're disease transmission ways. In other words, they can take stuff from the improperly disposed of waste and make people sick. We're also trying to manage things in a way to have clean water and clean air. We want to avoid exposure to toxic materials, and as you might imagine, improperly disposed of waste can be a safety hazard as well. And so we're trying to make sure that all those things take place. And of course, there's regulations involved with this, if you want to get to the next slide. We're trying to make sure that the facilities are operated properly, and the state actually requires that the local health jurisdiction manage solid waste or have a permit review authority of that. A lot of people don't realize that. So we investigate complaints. We make sure that facilities are in compliance with permit requirements. We implement our local solid and hazardous waste plan and help implement state laws and the state plans as well. So that's a quick overview. Patrick is here, and so he's the supervisor for our solid and hazardous waste program, and he'll give you some more information and some really interesting pictures.
Okay, now you got the floor.
Well, thank you very much for the opportunity to present today and tell you about our program. We currently have 3 staff people, including myself, and you'll see that we're actually involved in a lot of activities that you've probably heard about. Our main purpose is to uphold the conditions set forth in the sanitary code, so Articles 5 and Article 6 for solid waste management and hazardous waste and moderate risk waste. We always start off, especially on the solid waste side, we want to make sure that whenever we're engaging with a business or a property owner, that they understand the regulations. So we start off by educating them about what the codes are and what the expectations are from the community for solid waste management. We then permit the facilities that manage either a solid waste, so like the transfer station or Hazo House, or a compost facility. We make those people or those businesses gain permits, and then we ensure that they remain in compliance with the standards for those permits. On the solid or the hazardous waste side, we begin working with industry groups, and we coordinate with other agencies that have rules and regulations having to do with hazardous waste and hazardous waste management. And then we develop a program that we send out to the entire industry to make sure that each business gets the same message and there's an equal playing field for all of the businesses, so that we're not regulating, just a few of them and not all of them. So we make sure that each business gets the same messaging, and we individually go out to each one of those businesses within an industry. So for permitting facilities, we currently are permitting 15 solid waste facilities, 28 gravel mines, and 1 large compost facility. Solid waste enforcement is just like it sounds. We are a complaint-driven group, so whenever somebody sends us an email through our website or calls us on our solid waste hotline, we send an inspector out there and we try to see what the site conditions are at those properties. And these are the types of things that we see. Sometimes it's at the end of a dead-end road. Sometimes it's in the middle of a neighborhood. We are very effectual in communicating with property owners. This is primarily voluntary, where we work with the property owner and get them to pay to manage their own waste in the appropriate manner. So this is an example of a site that had 69 tons of solid waste removed. And that was just from last April until now. Here's another case where we had almost 18 tons of solid waste and metal debris removed. And here's one where a homeless camp was in the back of somebody's large lot. They didn't know they were there until their RV caught on fire and burned everything. And so it created a huge waste problem. And unfortunately for that property owner, they had to financially take care of that situation. When we run into issues where the property owner maybe has a financial difficulty, we try to connect them with some financial or social services that can help, and so we rely on some of the other programs within the county health department to help us connect those people to services that can assist them. So I'm sorry if this is a little bit too small. So in the last 3 years, we receive approximately between 200 and 300 new complaints for solid waste every year. Some of those complaints take multiple years to get in compliance, where other ones, it may take just 1 or 2 trips to the dump and they can get done with it in a week. As you can see, in just over 3 years, voluntary efforts from property owners have been able to remove over 1 million pounds of solid waste that has been accumulating on their own properties. And that equates to over $63,000 of tipping fees when they brought it to the dump and got it disposed of properly. On the hazardous waste side, these in the last 15 years, our group has gone out to each one of these different industry groups and every single business within those industry groups. We typically will start with the Department of Ecology and try to find out if there's a new regulation or maybe a new treatment system. For like dentists, they have silver recovery systems, or they have mercury amalgam separators, so that the waste that goes to lot will have reduced mercury and silver in it, so that those businesses can comply with the wastewater treatment plant's limits in what they are allowed to discharge to them. We currently have a local source control grant from the Department of Ecology, which replaces a grant that we used to have, and this will allow us to continue these sort of technical assistance visits for hazardous materials and discharges to the environment. This local source control program is a little bit more focused on activities that could result in spills that could get into our waterways or drinking water, and so it's a really good program to be involved in.
Patrick?
Yes. Sure.
I find all of it disgusting, but this one I find highly offensive, just at face value. Can you tell them? I don't want to know where it is, but can you tell me, is it being addressed or has it been addressed, or this is a current picture?
This was actually an older picture from a facility that we visited several years ago, and quite often these are the site conditions that we see when we very first get onto site. And so what we will do is we'll work with that business, and if there's a discharge like this where you can visibly see that it's already impacted the environment, what we'll do is we'll let Department of Ecology know, and so that way if there needs to be a cleanup, that they can oversee it and get it cleaned up according to the state Model Control or Model Toxics Control Act, MOTCA, and to ensure that when it is cleaned up, it's overseen by the State Department and it's adequate for what they want to have it, what levels of contamination would be acceptable.
Okay, so Patrick, is this in Thurston County?
Yes.
Does it look like that now?
No.
It's like green grass and kids playing and fish and all that? What's it look like now?
Well, right now, those drums would not be stored like that. We would make sure that they were all in secondary containment and preferably undercover. We make sure that there's no leaking drums, that they'd all be labeled so that we know what's in them, and then any sort of discharges that they have, we'd make sure that they have a spill kit and a spill plan, that they train their staff on how to respond to these things and where to take those contaminated materials once they're generated.
And this is a private owner?
Yes, this would be a private owner.
So we're on them. Or the state's on them, or everybody's on them?
Yes, as much as we can. I mean, sometimes we don't know that these conditions exist until our first time out to an industry or to a specific business, unless we get a complaint from it.
Good grief. Thank you, sir.
Mm-hmm.
I just wanted to say also, I know that you care about how this gets possibly into the groundwater and which direction it's traveling and to get into people's wells or not.
True, and
oh, yeah.
When we're involved, we would as part of the cleanup assessment, we would try to see, where are the local drinking water wells? Is there a potential for them to have been contaminated? They would do a groundwater assessment to ensure that anything that spilled hadn't reached groundwater, and then they would excavate out the soils that have been impacted.
Well, that's a huge project there.
Right. And
all the environment, the waterfowl, everything, yeah.
Yeah, and those cleanup activities are overseen by the Department of Ecology now.
Oh.
Been extremely helpful in helping us go through the cleanup process and addressing some of the deficiencies. So as he walks through the program, it's not just private property owners. We own county properties, and their responsibility is also to hold the county accountable for any particular violation within that context.
Okay, thank you.
We also manage several used oil sites. There are, I believe, 6 sites that we manage, as well as 25 privately managed sites for used oil. In just last year, we collected over 57,000 gallons of used oil, which would primarily be from people who change their own oil at home, as opposed to going to a shop to do it. These are not meant to be used by businesses, so this represents homeowners who take care of their own vehicles. Yes.
Sell the oil that you collect?
We get it re-refined. It depends on who we have a contract with. Sometimes the market price for oil allows us to get money, and sometimes we have to pay for that service for the collection and re-refinement. We also do hazardous waste collection at marinas. So one of the times that we went out and did a industry campaign for the marinas, we realized that most of the concerns were regarding the chemicals that people store on their boats or in their boathouses. So instead of inspecting the business, what we did is we set up collection for hazardous materials at a few of the marinas in town that have service attendants, so that we're not leaving these bins out available to just the general public, but there's somebody who can oversee it. And we have collected an enormous amount of hazardous material that would just normally be stored right over the water. So given the risk of water contamination, we want to make it as easy as possible for those areas near the shoreline to be able to manage them. We also have set up, and I don't want to take the credit for this program because truly it's the law enforcement police departments in our community that are managing these programs. And so they do all the collection and all of the incineration or transport to get these medicines incinerated. But what we did is we worked with the police departments to get all the bins, get the advertising out, and start the program off. And then we handed off all the keys to the police departments, and they've been running it ever since. All but one of our local police departments.
I won't mention, but Olympia's not on there.
So, in the last, you can see there's a tremendous amount of unused medicine that gets disposed of through these boxes, and I think it's pretty astounding. Just since 2010, we've collected over 41,000 pounds of unused medicine. So, proper disposal is one thing, but getting it out of the medicine cabinets and out of the reach of children, I think, is a great goal for everybody. And I encourage everybody to look in their medicine cabinets, and if you're not using your prescription, to get into one of these boxes.
I was surprised when I worked in Tenino PD how many hundreds and hundreds of pounds were brought into the police department all the time, even at Rainier. Women police them as well.
Yeah,
it's a great resource for community. Yeah, somebody passes on and a ton of medication come in.
I got to ask, how come Olympia doesn't have one? Is there one at the city hall or something real close by?
We have the closest one to Olympia.
I guess what I'm concerned about is if pharmaceuticals aren't handled properly and people flush them down the toilet, that just end up going to lot and it never gets treated properly, right?
Yeah, correct. It doesn't get completely treated. Not
Is
all
there
chemicals.
anything that we could do to? I mean, I don't know.
We can start the conversation back up with them and see.
I'd
if
like
they
to
might
see
be
what the
interested
deal
now.
is, because it's pharmaceuticals don't break down right anyway, I'm told.
Many of them aren't treated by systems. Some are, but many aren't.
Yeah. So if they're going into the sewer system, I just think we're missing something here. I don't know how to move forward on that, but I really want to move forward on that. I don't know, Hutch, I bet you do, don't you?
Not for this meeting, no.
No,
I mean,
well, maybe
yeah.
not this meeting, but God dang. Okay. We got to do something.
We're also involved in a lot of times I come in here once a year to talk about our integrated pest management program. So our hazardous waste group is also involved in the county's integrated pest management program. I'm the program coordinator, so I provide assistance to the department staff and to the Board of Health on issues related to our county's pest management. We also review pesticide products so that we can give you information about the hazards associated with the pesticide chemicals that the county is proposing to use. Those evaluations or reviews of those pesticide products end up getting put into the GrowSmart.GrowSafe.org website so that homeowners can go and find the least hazardous pesticide products. We also when a homeowner wants to change out their heating system from oil to gas, or if their tank is really old and they just want to decommission it, you get a permit from the county, and one of our staff would go out there and oversee the decommissioning, whether it be a removal or an in-place decommissioning, and ensure that any contamination that's associated with it is removed prior to it being closed up and never seen again. And unfortunately, we still have a methamphetamine lab program. It's very, very few. I think we've only had one new methamphetamine lab in the last 5 years, so that's fantastic. The rules that have been changed to get the chemicals that you can manufacture methamphetamine with has changed greatly. And it's done a fantastic job in reducing the number of methamphetamine labs from over 100 a year to, one in maybe 5 years. So pretty remarkable, and I think that is great. And that's our complaint hotline. If anybody has a complaint about solid waste, hazardous materials, it's 360-867-2664.
Operators are standing by.
That's right.
No.
Mark's standing by. Yeah. Do you have any additional questions?
No, sir, I don't.
You mentioned herbicides and pesticides. Do you work with any of the commercial industry groups, forest practices, or anything like that? Do you have any involvement there?
No, sir.
Okay.
All right, thank you, Patrick. So now we have Jennifer Johnson, who's an education outreach specialist. Do you have a slideshow also?
I do. I want to make sure that I can manage it.
You bet.
Yes.
You have the floor. Go ahead.
Good afternoon. Thank you. And Commissioner Edwards, I'm pleased to hear about your concern with pharmaceuticals. I'm also concerned with them, and I do have some ideas, so we should talk later.
We can talk now.
Well, could you please talk with Shelley about that
Yes.
before we get at our next meeting? Because it's bugging the dickens out of me.
Yes, it's an issue for sure. So we do education and outreach for the SEEP team, Community Engagement Evidence and Partnerships team.
SEEP is what?
Community Education Evidence and Partnerships. There are education and outreach specialists, there's an epidemiologist, and a nutritionist, all part of that group. And so we work hard to educate the community on a lot of different things. What I'm going to talk about right now is our education efforts for household hazardous materials. So our goals are to prevent exposure, to educate the public about what the heck am I talking about when I say household hazardous materials. We teach the people how to read labels, how to choose safer products. We talk to them about safe storage of the hazardous materials that they do have, and then how to properly dispose of them, utilizing resources that Patrick has talked about, such as Hazo House. So our goal is to protect public health as well as our drinking water and our surface water resources. We have some stats up there, kind of hard to see, but just to kind of provide a snapshot of some of the things that we do. We do some child care education and outreach. A lot of our goal is to talk to the folks in our community that can actually sort of expand our messages. So, for example, talking to people who run child cares, then we're talking to them directly, perhaps 100 people in the course of a year, but then those 100 people are in charge of course, hundreds of children. And so talking to specific individuals as a way to multiply our message broader out into the community, whether that are child care centers. We talk to garden retailers, so the folks that work in the garden stores, we talk to them, specifically the staff, about what are the safest products that you have available, so that when the public comes in and asks you, what can I use to deal with weeds or pests, they know, the store staff actually knows some of the safer products that they have on hand. There's a lot of public demand for, well, is it safe for my children? Is it safe for my pets? And we want to make sure that the store staff knows how to answer those questions. We are talking to landscape professionals. We train them about how, again, to manage our landscapes using a minimum of hazardous materials. And we have a lot of materials that we provide at the point of purchase. In other words, where do you go to buy these household hazardous products? We try to have information there so that folks can make the safest choice. Whoops, wrong way. So I've hit on this a little bit. We're focusing on bug and weed killers, cleaning products, personal care products, medicines, and automotive products. These categories are selected because this tends to make up what people have in their homes that are hazardous. I've talked a little bit already about our point of purchase. This is a little snapshot of what it might look like. This is in a garden center. We have a rack that on the top says free garden guides here, and provides then information. And as I said, we're providing that information to the public, and then we're also providing these trainings for the retail staff. And we're talking to people a lot about the cleaning products that they use. Again, this is how most people are exposed. This is how childhood poisonings oftentimes happen in the home. And so we're talking to folks, how do you have safer products? How do you store them properly? We do this through a lot of different means. We go out on our Healthy Homes visits, and we actually have the great privilege of looking under people's sinks, and they're asking us, what do I do with this stuff? And so we're able to really point out, well, these are safer, these are not so safe, this is where you dispose of them. We do presentations in schools, so we're talking to about 350 school students a year, again, helping them understand what the safer products are. How do you read a label? How do you safely care for yourself in the midst of hobbies and art projects and household chores? And we do talk to folks at lots of different outreach events. We're really trying to prioritize our outreach events so that we're talking at those locations where we're best likely to talk to folks that probably are not likely to read information because they're interested, but we can provide that information to them at the point of perhaps the Lacey Fun Fair or a wellness fair held in their employer's office. Whoops, I keep doing that. We do talk to folks about safer use of personal care products, and these are the hygiene products that all of us are using. Again, these are typically stored in our homes, and these are things that do not get treated very well by either our sewer system or our septic systems. And we are working on how can we create change at a higher level, if you will. So looking at some product stewardship, such as we've had really great success with the electronics recycling, looking at the mercury-containing fluorescent tubes, There is some legislative movement towards paint stewardship, and as I said, there is a lot of movement towards pharmaceutical product stewardship, so requiring pharmacies to accept unwanted pharmaceuticals is something that's up on the table. So that's exciting, I think. Patrick talked about how his group does the used motor oil collection. We try to make sure that the public knows that there are all these locations where they can recycle used motor oil, and so we have information, again, in auto stores, at the libraries, and we talk to about 300 driver's ed students a year about, if you're going to do it yourself, this is how you do it. We have all of the ways that I've talked about so far to reach the public, and then, of course, we're always trying new ways. We have a great Thurston Home and Garden. This is an electronic newsletter that gets sent out to about 4 people's homes. So these are people that have signed up to receive them. We have 400 right now, and that's up from, we started it about a year ago, and we had 200 people that had signed up, and so we've doubled our subscriptions, and we hope to double it every year for the next few years. We have our wonderful designer for that, our newest staff person, Cynthia Taylor. So she's been really helping us kind of jump right into the 21st century with some of our electronic outreach. We also, of course, utilize all of the social media channels that are available to us, from Facebook to Twitter and our public health blog. We also have articles in the Olympian, Thurston Talk, Senior News. So we are really reaching large parts of our community, and of course, we're always trying to figure out how to talk to more of them. Of course, we are all about supporting all of the efforts already. We are on the Environment Action Team with Thurston Thrives, and we're looking now at how can we utilize some possible grant funding to work with our schools, so that our schools are looking at the cleaning products that they're using. How can we encourage them to use safer products? And of course, we have some program challenges. I think Art was going to speak to them.
Talk about that really quick. So,
great.
So we do some really great things, as the folks have highlighted, but as with most governmental programs and other things, there are challenges associated with it. And I think Patrick talked about, or kind of highlighted it, some of the compliance issues we deal with. The public, there's different levels of expectations with things. Some folks think that when they have a lot of these start out as kind of fence wars, and not the really severe ones that you see, but they expect us to somehow mediate that. They think that somehow we're able to implement corrections more quickly than maybe we're able to. As Patrick said, we work largely to gain voluntary compliance. But if we have to take legal action, they have to go through due process. All that, it takes time. That's what some of those things that he described, that takes years. That's why. So that's one of the challenges of working on these particular issues. And funding and resources, not a big surprise, but Patrick indicated that we have a new grant that's helping us work with businesses on some of their practices. But that's good news, but the bad news is that a couple of the other grant sources that we have that are kind of key funding for our programs, one has gone away and one's been greatly reduced in volume. As far as the dollar amount, that's also one that affects the program that Jennifer works for, or that Jennifer and Chris do, something called Local Solid Waste Financial Assistance. Our program costs, it's fairly, we have really good staff, but it takes a lot of effort. It takes, to be able to pay the staff. So it takes a fair amount of money for the programs. And fund limitations. Folks have at different times have asked, well, why can't you do this? Well, some of the grants that we have, they're for very specific purposes. We can't go and use them for other things. We use tipping fees to pay for some of these programs. We can't use them to, say, fund the cleanup of a property, at least under most circumstances, because we have gifting issues. So there are those sorts of challenges that we're dealing with when we're doing our best to resolve them, but not always completely. And frankly, I think if you were to talk to Patrick, he'd say we're fortunate we have 3 staff, but we actually need more than that in order to accomplish those things. I think Chris would say the same, Chris and Jennifer, as far as the activities that we're doing. If we really want to make greater progress on some of the programs that we have, we don't have all the resources that we need. But that's not here to complain about it, but just to recognize that that's the reality of our work.
Mm-hmm.
And so that's really all I have to say. I don't know.
I have one quick question.
Go ahead.
Well, we don't seem like we're addressing things like on pharmaceuticals, for an example. But as you're educating the public, I don't know, a lot of the people I talk to have no idea that Victoria, British Columbia puts 40 million gallons of raw treated sewage into the Puget Sound every day. And I don't know, do you have that on one of your educational pieces so people will be aware of stuff like that? And I'd put on there, Olympia doesn't have a collection site either. But I guess I'm not trying to be too nice. I'm trying to be practical here and get some things done. So if we're going to educate the public, let's tell them the truth. And just tell it the way it is. Hurt somebody's feelings, I really don't care. Anyway, that's my 2 cents.
And Victoria, British Columbia is doing it.
Yeah.
What's that?
You know they're dumping 40 million gallons of untreated sewage every day.
I learned that fairly recently, yes.
Well, I gave a presentation, I don't know, a month or so ago to a very environmentally conscious group, and nobody knew it in the whole group. There's probably 40-some people there. I was quite surprised.
But the good news is they are finally funding their wastewater.
You know what? I've heard that story for 50 years, Art.
Right. But I sent you the information on it.
I know. I hope you're right. I know you told me Floaty's going away and all that kind of stuff. Mr. Floaty, well, I'll believe it when I see it.
Or when you don't see it.
Yeah.
Very
Well
good.
said, Doctor. Well said. I just want to follow up and give my 1 cent worth, and that is when it comes to issues of health and social policy, it's important and vital that we engage, as you said, all the parts of our community, and I would add all partners in our community, which is each and every city. That's why I brought up that issue of Olympia not having a collection site for their pharmaceuticals. And I was going to be bringing that to the Board of Health. I didn't expect to do it today, but it happened. Because I think it's a vital piece, especially in working with LOT and what they may be looking at with pharmaceuticals hitting the water, hitting the sound. And we don't have the equipment. I sit on the LOT board as well. And we don't have the equipment to filter out that segment. But that's all up and down the Puget Sound byways and such. So it's a very important issue to address, like I said, in health and social policy, is the pharmaceutical collection site. And I don't think anybody should be exempt, but there are some people that are autonomous. But then we get into other debates and issues about that later.
Just as a bit, not to get too far into history, but those we have, when we were able to get grants to pay for those boxes, they've been offered throughout the community. So it's we can't always speak for why people don't always take the opportunity.
No, but I have years past been part of the discussion.
Yeah.
Anything else, Jennifer?
That's it for me. I did bring a ton of handouts. As an educator, I always come with stuff. And so I can just leave these up at the table just to give you a sense of what we are putting out into the public and what our messages are.
You bet. I'd like to thank you so much.
Thank
for
you. You're
what
welcome.
You're doing for
Yeah.
outreach and education. It's been instrumental for us.
Super.
Turning the public's eye towards what you do. So thank
Great.
you.
Thank you.
Thank you.
Thank you very much.
Art, turn to you for the director's comment, and Doctor.
Okay, so there's just a few things I was going to mention that took place in the month of January. One, in dealing with Chris's group, and Jennifer mentioned this briefly, is the Healthy Homes program. That's something where we train folks to be able to go out into the community and do the sorts of outreach that Jennifer talked about, where they can look and talk to people about how they're managing things in their homes to make them as safe and healthy as possible. And so the good news is that we're offering training to volunteers, and this year I think we've got a record number amount. We've got 30 people. This is, I think, the first time where we've actually had to form a waiting list. And so this is something where folks can come and they receive training, and then they are able to go out into the community and do these sorts of outreach and inspection efforts in order to help folks have the healthiest homes that they possibly can. And if you wanted more information, I know that Chris and Jennifer could talk about that. But that's really good news. I'll mention a little bit about environmental health. I looked at our numbers for 2017 as far as our septic system permits and land use and all that. And it's for the 5th year in a row that volumes have increased. And so the past few years, they've been going up on about an average of 13% a year, and the revenue's been going up concurrently. And so sometimes when you hear about the economy turning around and looking for evidence of that, I think this speaks to that. And so especially it deals with a lot of the septic permit related activities, and also the reports that we do when someone sells a home that's served by a septic system, and the evaluation that takes place as part of that process. So that's been keeping our staff really busy. And so we're fortunate that you authorized us to hire another person a while back, and so we're trying to get ahead of that workload, but there's quite a bit there. I know the commissioners were involved with some of this, and maybe Shelley mentioned it before, but recently there was the homeless count in Thurston County, and so that was completed on January 25th. The numbers will be coming out soon for the contractor that was used, and that's very important information to get a feel for, again, how big is the issue as far as having homeless folks. And as folks have indicated earlier, that without housing, that it's really hard to live a healthy lifestyle, whether it's for a variety of reasons, and you're the experts on that, but I just wanted to let you know that that was a participant, and our director was also part of that survey as well. One thing that the department recently completed is something called the Foundational Public Health Services Assessment. That's work that's being done by a contractor for the state, and the work there is to try to help us identify in a whole variety of public health areas the expertise that we have and our capacity to do work in the public health field. And it's actually a survey of the whole governmental system, so it's not just counties, but also the state as well, and some of our other partners like tribes. And the idea is to, again, see how good a job can we do as far as dealing with environmental health things, or dealing with investigating disease and outreach, education, doing the business stuff like we need to do, like can we actually hold hearings and do stuff like that. And there's two prongs to it. One is to figure out, do we have the expertise or to be able to do it? And the other part is, do we have the capacity? In other words, even if we know how to do it, do we have enough bodies that can actually perform the work? And so that work was done. We're expecting later on this year to be able to get the results of that survey. So that'll help us as far as trying to help us do the best job that we can. And also, it's going to be used by the state to try to evaluate what the health needs are across the state, to be able to talk to the legislature to see, okay, do we need additional resources? How much do we need? That sort of thing. So that you'll probably be hearing about that in the future. But that's it took quite a bit of work. I ended up dealing with the environmental health stuff with the help of our staff. It took the better part of a week, split up over several weeks, to be able to get that stuff done. Some good news, and Jennifer has left, but I'll talk about some of the special recreation program, or I guess we'll call it special recreation. There's a bunch of folks who've participated in the last bit. For instance, this last session, we had 36 folks participating in the swim club, and 21 folks went to the Puyallup Fair. And there was to watch a dog show, and so that's one of the services that the county is able to provide for folks with special needs. There's also some folks who participated in a quarterly game club again, so it's actually open to all members of the public, but the programs are designed to be able to focus so that folks with special needs are able to participate, or their family members. So that's a very nice service that the county has, and we're very pleased to be able to have it. And let me see, I think I maybe had one more. And as far as the Nurse Family Partnership Program that you've heard about quite a bit, January 1st marked the day where the full regional program took effect. And I think you've authorized contracts between us and Mason and Lewis counties, as well as some different things for Thurston County. And so now we've got kind of the full regional program in effect for both Thurston, Mason, or all three of Thurston, Mason, and Lewis counties. And in last year, 2017, the Thurston County Nurse Family Partnership Program served 225 families, and so that's good news there. So those are the highlights. I could talk about more things, but we're running late.
You're good.
And Dr. Wood. Well, I don't want to take over your show.
Thank you. Can people hear me? Okay, good. So we're lucky on the west coast of this nation, because it appears that our influenza positive test rate and hospitalizations have at least leveled off and maybe started to turn down. That said, Thurston County has had its share of influenza-related deaths, not above normal, but they have happened, and they have occurred in the elderly, people over the age of 65. I will say for emergency preparedness and response, I was privileged to spend a couple of hours with our partners at the Chehalis tribe to just talk about how we could, there's been a mutual aid agreement that has been worked on for the past couple of years under the auspices of the American Indian Health Commission. And so in order for the tribes to know the health officer, I've made a point of going and talking to them so they, if they need any assistance or if they can assist us in the event of an emergency. And I will leave it there unless you all have any questions.
Any questions of the doctor?
I don't think so. Thank you. Yeah. No, good. Thank you.
Alrighty then. Is there any last minute comments or?
I want to talk to Patrick about this business about the pharmaceuticals, but I won't tie everybody else up. I'm gonna go bug him a little bit.
Yeah, just,
oh, go ahead.
Just one more thing, Chris. Again, thank you for the effort you put in as far as community design and getting the award with Aetna. It's been just, I know you've been working on it a couple of years, in fact, and so I've witnessed it and witnessed the hard-earned effort. So thank you so much. With that,
And Jennifer and Liz.
And Patrick, sure. Yeah. And Jennifer, yeah. Is there a motion to adjourn?
There is. I move to adjourn the Board of Health meeting of February 13, 2018.
Second.
It's been moved and seconded to adjourn. We are adjourned.